Dear audience, we would like to present our study, Prenatal Diet, Plasma Micronutrients Metabolome and Inflammatory Status Influence the Development of Atopic Eczema in Early Childhood. This study aimed to determine and to convolute the contribution of prenatal maternal dietary and micronutrient metabolite patterns in shaping the maternal and infant immune responses, and infer their roles in influencing risk phenotype for eczema. At the 26th week of pregnancy, maternal dietary intake was assessed using a 3-day food diary. Maternal plasma micronutrient profiling and maternal plasma and infant cord blood immune markers and metabolites were analyzed. Supervised structural equation models were applied to deconvolute the putative biological pathways between maternal and infant datasets. The signature of atopic eczema phenotype in offsprings is characterized by maternal prenatal diet, low in potassium and fiber, plasma micronutrient metabolites, low in potassium, vitamins B3, B6 and D and high in cystathionine, and increased inflammatory marker, C-reactive protein CRP, of mothers of offspring with eczema. And these maternal signatures were associated with infant signature of cord blood metabolites and immunity, of reduced anti-inflammatory metabolite, trigonelline, CRP, and increased pro-inflammatory cytokines IL-6, IL-7, MIP3-alpha, VEGF-A and TGF-beta-1. We speculate this interplay of pro-inflammatory and anti-inflammatory mediators would collectively influence the development of eczema in the offspring. We then went on to investigate how these parameters interrelate with the aim to unravel the putative biological mechanism. Here is the simplified model obtained from integrated pathway analysis. Green and red lines indicate the significant positive and negative associations respectively between mediators. We identified 3 plausible biological pathways that might collectively predispose to eczema in the offspring. Firstly, association between maternal dietary fiber, plasma vitamin B3-1-MNA, B6-PLP and cystathionine, maternal CRP and infant cord blood trigonelline. Current evidence indicate that dietary fiber affects the bioavailability of vitamin B, hence potentially facilitating gastrointestinal absorption of vitamin B. Vitamin B6 is an important coenzyme required for the activity of key enzymes in tryptophan-kynurenine catabolic pathway resulting in the synthesis of vitamin B3 and trigonelline. When vitamin B6 is restricted, elevated cystathionine via homocysteine metabolism is observed. Association between maternal dietary potassium, plasma potassium and maternal CRP. There have been no prior reports of the negative association between low plasma potassium levels and high CRP levels in eczema. Potassium may have an anti-inflammatory role, as this negative association is seen in type 2 diabetes. Thirdly, association between maternal plasma vitamin D and infant cord blood TGF-beta-1. Our data corroborates reports that prenatal vitamin D insufficiency deficiency influences infant immune regulatory cells and cytokines TGF-beta-1 and inversely related to atopic diseases in early childhood. In tandem, these associations correlated with increased pro-inflammatory and decreased anti-inflammatory mediators in maternal plasma and infant cord blood of the eczema group. In conclusion, our findings may pave the way to design effective nutritional and dietary intervention enriched in fiber and potassium, plant-based food, during pregnancy to reduce the risk of eczema and its related disorders in the offspring.